Hello, I'm Dr. Gill from Everett Spine Rehab, and today what I want to do is go over 5 signs that you should not ignore if you have back pain. Let's admit it, as adults we've all faced back pain at some point or another. Back pain really makes you think that you're getting old, doesn't it? While a lot of people think that back pain is normal, I'm here to tell you otherwise. If you've ever experienced back pain, then it could be a sign of something more serious. Okay? So while ignorance may be bliss in some cases, that is not true when it comes to your back pain. The truth is, sitting around and ignoring it or even masking it with pain medications and waiting for it to go away may just make it permanent and worsen the situation. And as a guideline, there are 5 specific things, and if you experience these, you should definitely get your back pain checked. First and foremost, if you're experiencing a strip of pain that radiates from your back to your foot or leg, then you might be facing some nerve irritation. You should get checked immediately because it might not go away on its own and it might lead to worsening pain. The longer you wait, the more treatments you might need, the more it's going to cost. Now, for the second sign, if your leg is hurting and making you limp, then you should get screened by a chiropractor as soon as possible. The limping might become permanent if you ignore it. Better safe than sorry. Further, the limping may cause other issues in other parts of your body, such as your hip, your knee, or your ankle, on top of the low back. Further, the low back pain might start spreading upwards into your mid-back and quite possibly into your neck and leading into headaches. We are one connected being from our head to our toes. Symptoms down in our feet can work their way up, just like back pain can work its way down. Now, the third sign you should watch out for is urinary incontinence with numbness in your groin area. That could be pretty serious stuff. Now, urinary incontinence is the term given to state where you don't have full control over your bladder and your urine starts to flow out even when you're putting in a conscious effort to control it. These could be symptoms of what is called Cauda Equina syndrome, which means that the nerves at the bottom of your spinal cord are being compressed. The treatment for Cauda Equina syndrome is immediate surgery because if it's done too late, you may not fully recover. Imagine that, not being able to hold in your urine anymore. So therefore, you should always get yourself checked by a chiropractor immediately if you're facing such problems. For the fourth sign, if you have any chills, fever, night sweats all over the body, this could be your body's mode of showing that it's in pain and out of alignment. And the fifth and final symptom is an imbalance with pain. This is especially for women. As women become older, they also develop an increased risk for osteoporosis, which weakens bones to the extent that they get fractured easily. This is why old women usually get fractures when they fall, especially in the hip. And should that happen, the prognosis after that is usually not very good. I lost a great-grandmother who fell, cracked her hip. Within a couple of months, she passed away. So, if you're finding yourself unable to balance yourself properly and you're feeling pain in your back, you should get yourself checked as soon as possible. And the greatest place to start with that is by your chiropractor. Just like if you had some aches and pains or if you had other symptoms, you're not going to go straight to a specialist, you're going to go to your family doctor. If you have tooth pain, you're going to go to your dentist. You're not going to go to your family doctor or a specialist right away. So if you have back pain, come see me or go see your chiropractor if you're already established with one. Get screened to see if you need to be referred out to a specialist or if this is something the chiropractor can handle in his or her own office, which usually ends up being the case, okay? Especially if we catch it early enough. So let me know if you have any questions about any of these symptoms that may accompany your back pain. And please share this video with anyone that you think might find it useful. Thank you for watching, and I wish you the best of your health.